Did you know that the teeth can move by themselves even without braces? I'm gonna explain to you what it's all about. This movement from here to here is called migration. What is migration of the teeth? I mean, if your dentist says, oh, you have migration of your teeth, what it literally means is that your teeth are moving, and our teeth are moving constantly. So if you have a wisdom tooth and you don't have a space where to go, that wisdom tooth is gonna start pushing to the side. That's the normal movement that the teeth have. Either they go in a parallel way, that is not always the case, but most likely they're gonna be inclined towards the front of our mouth and start pushing other teeth to the point that our teeth are gonna be like overlapping one to another on the upper or the lower teeth. And the other situation of migration is because it's an abnormal movement. This is not a movement that is normal. However, the cells somehow have a program that they have to continue pushing to the rest of our lives, to the front, to the back. To the back is not that common, but it's mostly to the front, to the outside, and to the inside. And what are the causes of migration of the teeth? One, as I tell you, and I love this model to show you, that if you don't replace this tooth, when you lose this tooth, and you don't replace it with an implant, and you don't protect the space, this teeth, this tooth is gonna find a support, and it's gonna start, as I was telling you, to move this way. Or this one can move this way or that way or move to sideways. That is why it's one of the causes when you are missing a tooth. The other cause is that you lose bone. You know, through the time, I'm gonna turn around to see the gums, how the gums start from a normal aspect, they start getting inflamed, and then when they get inflamed, you start losing bone, and this is called gingivitis, and this is early. At this point, when you call periodontitis, is because this yellow part of the tooth that they have in this beautiful model has the illustration of black, and then the calculus, they start seeing in the black part. So as much as the periodontal disease or the gum disease is advancing, then you lose bone, and what happens is gonna be immobility. The other cause is that you have an abnormal bite. When you have an abnormal bite and you start creating trauma in your teeth, that's gonna create migration because the teeth wanted to protect from this either clenching or grinding. They start moving, and that's another cause of migration. Another one is, I don't know if you guys have seen, people that has this front area outside. Why? Because they start sucking the tooth for so many years since they're babies, just like the baby, and sometimes they don't stop until they are like 5, 8, 10, and that is gonna cause, believe it or not, that this area on the palatal start elongating with the pressure, with the simple pressure of our finger, and these teeth pretty soon are gonna be moving with the bone together outside of the mouth. And that is because it's the fingers sucking with the babies. Some even adults have that habit. It's a bad habit that it can be also corrected. And the other situation that why we have migration of the teeth, the other cause is aging. Aging of the tooth that has nothing to do sometimes with the age of the patient. Sometimes can be the same, but the more age, the more migration that we can have, and the more spaces they can have between the teeth. That is one of the multiple causes of migration of your teeth. What are the warnings? How do we know we're having migration of the teeth? Pay attention to this. Look at this model that I have here, another panchito I call it, and look at the spaces that we have between these teeth. These teeth should not be that separated, and here they are because the patient starts losing bone and the gums start receding to the point that sometimes you can look at the roots of the patient. That is one of the signs, can be on the lower, I put an example on the lower, but also can be on the upper teeth. And patients are so conscious that it can affect, because what the other warning is that they feel the smile is switching. So they cannot smile well because now they feel, and believe it or not, the face have to be perfectly aligned with the middle line of our teeth. And when that doesn't happen, you can see people that when they smile, it looks like if they're twisting the mouth, but in reality, it's because the smile is moving due to the tooth movement. That migration happened in some of the patients. Also, another warning is that you start chewing and you start having problems. That is the sign your tooth move. And now what you're gonna do? Well, you gotta see the orthodontist. We're gonna see what are the treatments that we're offering. That is some of the causes, and obviously, as I told you, the bone disease, periodontal disease, who's gonna affect the bone and the gums of the teeth. What are the different treatment options that we are gonna recommend? Number one, it's very important because you can avoid all of these problems, losing the gum, losing the bone. How are we gonna avoid that? If we are at the stage that our teeth are moving or it has severe periodontal disease or simply gingivitis, what you need to do is to see a periodontist or talk to your dentist and be sure that that periodontist knows how to treat these problems of mobility or how to avoid the migration due to periodontal disease. Another treatment option that we have is, well, of course, as I tell you, you have to go to see an orthodontist. Always seek the help of your general dentist first, prosthodontist, or restorative dentist that is capable to refer you to a specialist that is just dedicated to braces, or if they have experience in Invisalign or putting orthodontic treatment, also they can give you the recommendation, because when the teeth are migrating, when you put the braces, you're gonna place them back where they belong, and then you need to use a retainer. Another treatment option, that if you have occlusal trauma, after you see your dentist, after you have a treatment, you need to wear, after orthodontic, a retainer, or in this case, an eye guard, to avoid damaging more your teeth when you are doing an occlusal trauma, we call it, where we are traumatic when you are doing your regular mastication. And last but not least, the other example that I give you, when you are missing a tooth, you need to replace the tooth in order to avoid that this tooth, when you don't have it, start moving to one side, to the inside or to the outside. How do you do it? By replacing the tooth, or simply by placing a tooth here that is gonna be like a bridge, and there's gonna be this space, but the simple fact that you have the coronal part is gonna help you to maintain that space. For me, the most important, obviously, and I want you to remember this, is that an early diagnosis and an early treatment plan is gonna give you the results. The less we touch the teeth as dentists, the best is the patient is gonna be. Unless you guys need the treatment, take care immediately. I'm Dr. Fanny Yacaman, and I hope you like this episode. Take care.